Hello, everybody. My name is Shelley Reynolds, and I'm going to go ahead and get started here in a minute. I was going to say good afternoon, but I see we have somebody joining us from Australia who said good morning. So good morning to you over in Australia, and good afternoon to the rest of you here in the United States. We're really excited about this. Really, it's our closing showcase of many months that would have typically have been live. And so we're excited to have this opportunity to share this information with you and to kind of share our learning. You are on a WebEx instead of an opportunity to interact as much as we normally do, which I apologize. Usually there's so many participants, it's a much easier way for us to be able to make sure it's stable. But you do have the opportunity to chat with us. So we'd love to hear from you, where you're from, any comments that you hear that you have questions about, or things that validate things you're working on. Be sure to put that in the chat, or you could put them in the question and the answer box as well. With that, I am going ahead and get started. So before I get started, though, I do want to, we've been able to do this, and this has been made possible with the support of our different sponsors. And so when we typically meet in person, you have the opportunity to meet all of the different sponsors. And so each month we have given our silver and platinum level sponsors an opportunity to share their partnership with the LifeCourse Nexus. And so in a few minutes, I'm going to pass that over to Sandra Bloom. But before I do that, I just wanted to kind of talk about what we've been doing since June, believe it or not. I remember when we were very disappointed as soon as the pandemic happened, and we talked about our in-person showcase. It was really disappointing in the sense that that was an opportunity for us to really come together and learn about what's been happening related to LifeCourse, but more importantly, a chance for us to connect with one another. The LifeCourse has really been a foundation for creating a sense of community and learning from many different disciplines, many different sort of experiences on how people apply it. So back in June, we kicked off, believe it or not, and every month we've had one of these live sessions. All of the live sessions are taped and archived on our website. So I suggest to you, if you haven't seen some of the other sessions, to check them out. The other thing is we usually at the conference do it in terms of what we call our innovation areas, or sort of our strands. And so each month is really highlighted at a different strand. So in July, we really focused on the education system and how we were helping students and really seeing student outcomes. In August, we really focused on the person level. I mean, the person-centered outcomes from the person's perspective, as well as staff, as well as providers' perspective. In September, we heard about how organizations were building staff capacity and utilizing the tools and framework for creating teams. In October, we really focused on outcomes for individuals as it relates to adulthood and employment. And in this last closing one, we're really going to be focusing on the person within the context of the family, which is one of our major foundational principles of the LifeCourse framework. But I wanted to just take a minute to talk about the Charting the LifeCourse Nexus. That's our center that at the University of Missouri, Kansas City Institute for Human Development that leads this effort. And we intentionally use the word nexus because we want you to know, and anyone that interacts with LifeCourse tools or the framework to know, that the nexus is a place for you to come together and collaborate with us, and to bring your ideas and integrate that with LifeCourse so we can really continue to transform wherever LifeCourse ends up going. And so we're really here to support you and your growth and all learn together. We all do that, though, with the core belief of all people and their families having the right to live, love, learn, work, play, and pursue their life aspirations in their community. Everything that we do, from the way we run the organization to the tools themselves of being universally designed to the partnerships that we have, all come back, are they aligned with our core belief of supporting all people people with and without disabilities, people of all colors and cultures, and for a lot of different reasons, for education, for health, for retirement. Really, it's endless on how you can utilize the framework and the tools. The framework over the last 10 years has become a framework that has driven transformational change. So not only can we use it with individuals, but we can also use it for system-wide change for organizations and for policy. The icons have become a language in and of themselves, a way for people to visually see different sort of aspects that have been hard to articulate in the past, or ways to organize. They also are a set of tools that you can use to put into practice, and they continue to grow and evolve based on all of the different ways that you guys are utilizing them. But more importantly, trying the life course is really a way for us to network and learn from one another. Um, the next part is transformation. We can utilize these frameworks and tools at all levels. So no matter what level we're using it at, it's about enhancing life possibilities, about sharing hopes and ideas and fears, setting higher expectations, navigating the future, advocating for a vision, and tools for problem solving and planning. So whether you're a policy leader, whether you're a family member, whether you want to utilize these in your own life, they're all focused on those outcomes over there. The thing about them is we also keep creating very specific tools, starting specifically with tools that help a person. But we've really also started to focus on the family perspective and how the family perspective is different than the person's perspective, but it's valued. And how do we help a family articulate that and represent that and talk about that and have a place to have their voice heard? We also have a set of tools that are designed for professionals to use, whether they're doing formal planning with a person or whether they're doing team or organizational planning. I wanted to put this slide up here before I pass it over to our sponsor, but because I wanted to tell you that this started over 10 years ago. And if it weren't for the National Community of Practice on Supporting Families and our partnership with the National Association for State Directors for Developmental Disability Services, which is that long acronym NASDS, we really wouldn't be where we are today. It was that National Community of Practice and the 6 states that were part of the original Community of Practice that really helped us refine and define the framework, as well as helping us to really use it strategically for transformational change at a policy level. And so what you're going to see today in our closing is not only how the life course has impacted families, but a couple of them are going to look at how it's impacted the DD Council's work, as well as our state systems change. And so I think it's really important for you to recognize that that conversation around the person within the context of family was really solidified in the ongoing work that the Community of Practice continues to do. The Community of Practice is now in 19 states and continues to drive person-centered and family-centered changes, and it's very exciting. So let's go ahead and get started. So we are really excited about our partnership with, and as a partner and a sponsor for this event. It's a partnership out of an organization out of Canada that we've been working with for some time, but are very dedicated to trying the life course. And I appreciate our partnership because they're very aligned in terms of the values and the goals that we have together. So with that, I'm going to pass it over to Tulia.
Thanks, Shelley. Hi, everyone. It's great to be here. I'm one of the principals of Sonder Bloom. The other principal, Sal Morello, couldn't be here today, but we are really proud to be collaborating with the Life Course Nexus. Just a bit about Sonder Bloom. We are a social services and healthcare consulting firm. So our focus has really been on supports and services for people with intellectual disabilities. But more generally, our aim is just to create products and services that really promote choice and flexibility. So the concepts of inclusion and independence are really important to us. And so that's what we strive to achieve in the programs that we design or support. A lot of the work we've done is in support of self-directed planning and use of funding for people with intellectual disabilities. And on that note, one of the problems we were running into in our work is that creating a PDP, so a person-directed plan, is often seen to be kind of a one-time activity. So it might set the stage for successful outcomes, but there's not always consistent follow-up to see whether outcomes were indeed achieved, or to see how the plan should change if life circumstances are changing or the individual is changing, for example. So it's often something that's done once and then sort of shelved, which doesn't help anyone. So when we came across the Charting the Life Course framework, we saw how well it lent itself to sort of a more continuous and ongoing planning. It also allowed more frequent interaction with supporters, and just the ability to revisit plans and goals. So our idea was really to leverage the Charting the Life Course tools and introduce an online aspect. So we've been working with UMKC for about a year now to develop the LifeCourse online product. And the idea was really to adapt the framework to a format that you could easily engage with online. We really wanted to create something that people would return to regularly to update their plans, to be able to put in comments or reviews, and also just to be able to interact with the different people in their lives. So as Shelley just mentioned, the importance for the family's voice to be heard. So we wanted to make that easier as well, and have it be a place where the family and other people in the person's life could comment and leave their perspective. So at this point, we've created a version 1 of the product, and it's a fairly robust version 1. So it includes a lot of the features that we had initially envisioned for it. Of course, there's still more work to be done. But for example, we have the Charting the Life Course tools adapted to an online format. So we have the life trajectory, the support star, the visioning tool, and so on. But we've also included other features just to make it as useful as possible as a tool. So for example, we have the build your team feature. So there you can grant access to your account to other people in your life. You can assign different permission levels depending on how much or how little you want others to see. We've also included a dashboard. So within the dashboard, you can basically access all the resources that you would have developed through completing the Life Course charting session. And you can also upload other resources that you think might be important to have in your sort of repository of information about yourself. And the dashboard also includes a built-in calendar. So there you can create events, and you can attach different goals to different events if you want to. So you can also comment on events. You can review them after they've happened and just keep a record of them if you choose to do that. There's also a section where you can choose to add goals. And again, you can attach goals to different life domains. You can rate your goals, and you can track your progress on them and just adjust them as needed. In the dashboard, there's also an area where you can save your favorite places. So you can basically list the places you go to often, and you can make comments about them or notes for others to read about your sort of relationship with those places. There's also a map visualization in the dashboard that basically pins all of these places for you. So you have a nice visual of all of your favorite places. We've also incorporated another feature that we call raise your hand. So if you're looking for someone to help make an event happen, for example, so either you need the support or you just want the companionship, you could indicate that through the event feature, and people who interact with your account would be sent an email, and then they'd be able to raise their hand to go with you or to take you. So that's, I guess, a bit of a summary of the app we've created. I've listed some of the features. It's currently in beta testing with a few volunteers that UMKC has thankfully managed to get for us. We're hoping to get some feedback from people at the beginning of December to help improve it. And then we hope to release it, the first version of it at least by the end of the year, or possibly early next year. So yeah, I really look forward to hopefully having some of you try it out as well and letting us know what you think. We are really excited about all the potential it has and all the people that it will hopefully reach. So thank you.
Thanks, Julia. We appreciate your sponsorship and your partnership. And I know people are going to be very excited to start seeing an interactive tool online. So thank you. So with that, I'm going to ask Julia to turn her camera off, and I'm going to move into our panel, please. Thank you. So now I'm going to get started on charting the life course for empowering families. And so first up is Karen Connor, who comes to us from St. Charles, Missouri, and she's with the organization Family Advocacy and Community Training. So Karen, if you'll turn your camera on and unmute.
There, can you hear me?
Yes, we can.
Good, thank you. Thanks, Shelley. So my name is Karen Cooper, and I am with Family Advocacy and Community Training, or FACT, and we are a nonprofit agency in St. Charles, Missouri. We provide educational advocacy and peer parent support to families that have a child with a developmental disability and or mental health challenges. Everyone who works for FACT has a child or a family member with a disability. We work to empower families to use their voice to advocate for their child and their family. I've been with FACT for 15 years now, and I started as an educational advocate, and now I'm the training specialist. And who you see here is my family. That's my husband, Mario, my daughter, Sarah, my son, Sam, and me. Sam is 26 years old, and Sarah is 25. Sam was identified with a language delay at 2.5 years old. And he really was presenting with some significant behaviors. And that's really where our journey started. And around age 7 is when he was diagnosed being on the autism spectrum. So what I love about the Life Course is its focus on family. Having a child with a disability affects everyone in the family in different ways. For our family, I quit my job as a bank branch manager so I could focus on getting the supports my son needed. And we were very lucky that my husband's job was able to support us. You know, for my daughter, and you know, this was from a very young age, they're only 18 months apart, she missed out on a lot of different things, like spending time with her friends because she had to go to CM's therapies with me. Sometimes her friends weren't allowed to come to into our home because Sam was having a meltdown. I remember Sarah asking me one time, why do we always have to make adjustments for Sam? Why can't he adjust for what we need? Almost everything we did and how we functioned as a family centered around Sam's support needs. And getting those support needs could be very challenging. We always had to report how awful things were in order to get supports. Recently, I was talking to a parent who shared she felt like she had to stop giving her son his medication and fill him up with sugar so she could show how bad things get, so her son would qualify for supports. That's another reason I love LifeCourse. It allows us to focus on the strengths of the individual and family and not have to rely solely on eligibility-specific supports. And that was something that was really hard for me to learn and accept. We were struggling a lot with Sam's behaviors at the beginning, and our family was not getting the supports we needed to function. So even though I knew Sam had many strengths, I couldn't focus on them because the challenges felt so big, and I had to keep focusing on the negative in order to get the supports that our family needed. I didn't know how to use his strengths to help him through his challenges. It wasn't until after I started working in the disability world that providing parent-to-parent support for families that I realized how valuable the LifeCourse tools are. If I had had these tools when Sam was younger, I could have used the support star to determine options for Sarah not to have to go to therapies and spend more time with her friends. I could have used the support star to look at Sam's strengths and other resources to help him through his challenging behavior. Completing a good life trajectory for each of us could have empowered us to understand we can make adjustments for Sam, but Sam could make adjustments for us too, and we can all work towards our good life. And I feel as more and more systems use the LifeCourse framework, we now have that common language for families in navigating those systems, and a way to support both individuals and families that focus on strengths and multiple resources to assist everyone in reaching their good life. Everyone in my family is living our good life. My husband and I are empty nesters and loving it. My daughter is working in her chosen career and just moved in with her boyfriend. And my son works in information technology systems and has recently bought his own condo. That's where that picture came from, a little over a year ago, and he uses no eligibility specific supports.
So Karen, thank you so much for sharing your story. And Karen will be back on our panel where we'll ask her more questions about the work that she does and the impact of LifeCourse. But I really wanted to start it off with Karen just because I think that some of the things that she's learned personally and professionally on how the LifeCourse can really be aligned and utilized to create the lives that you want would be a great way to start us off. So thank you, Karen. So next I'm going to pass it over to Colette, who is from Missouri as well. She's from Buchanan County, which up in the St. Joe area near our Kansas City airport, and she's with Progressive Community Services.
Hi, as Shelley said, I am Colette and I live up in Buchanan County. A little bit about me. My biggest claim to fame is being Gunner's mom. He's 9 and he experiences autism. I am a self-proclaimed former green mom. I had a huge wake-up call during my training for the family navigator role that our day-to-day activities were pushing my family toward what we didn't want and not what our vision of a good life is. But until that time, we had never really, that was kind of my first experience with trying LifeCourse, was during a really deep dive in my training for my family navigator role. So I realized once I started doing all the tools, the long-term planning tool, the vision of a good life, and the STAR, I realized that it just wasn't a fit. So I had to take a look at myself and our day-to-day and change our routine to help my son get to where we wanted him to be and where we felt like he wanted to be. When I first started my role at Progressive Community Services, it was about 4.5 years ago, and I was a part-time employee. This work at 10 hours, 15 hours a week worked out great for me at the time. My son was about 4 and he was still in half-day preschool. So without that flexibility, I really wouldn't have been able to work outside of the home. So it kind of really worked out great for me. I was very passionate about systems change and kind of changing the way our community viewed people with disabilities and viewed children like my son. So this was just a really great fit. When we created this role, well, it was kind of already started, not kind of, it was already an idea and had started before I was hired. But they really wanted to focus on the principle of the all. And it was really important to them to be there for families, both that were entering the formal service system through information and referral, but it was also important to invest in those that didn't want to be in the formal system or couldn't be in the formal system. So kind of finding everyone in our area who had a developmental disability and their families and providing them access to those 3 buckets of support, because regardless if they wanted to be in the formal system or they were in the formal service system, they still had a need for those 3 buckets of support. So we started to develop entry points for them to be able to do that. We established Good Life groups. And in that pilot group, we specifically reached out and invited parents that we knew were not in the formal service system. And we wanted to help them get access to the information about trying LifeCourse tools and be able to live their vision of a good life and establish those visions and learn about the framework and how it can help them. So we taught them about trying LifeCourse and how to apply it in different areas of their life, whether that be IEP meetings, conversations with their family. And a lot of them also used it to help build their social capital and explore their personal networks to identify their next steps toward their visions of a good life. We've continued to add those opportunities through the Good Day, which is a transition age workshop, 1-day workshop that we do in the summertime for high school students. We have created another program in partnership called Little LifeCourse, which is a really fun preschool program and with a partnership that we created with UCP and inclusive integrated preschool program that we have in our town. And then this year we've added LEAD, which is a leadership training for parents or people with developmental disabilities that are interested in getting involved in system change. And they want to use Trying LifeCourse for strategic planning to be more involved in the community, whether that be on state boards or state commissions or within their child's school or at their workplace or wherever it might be. Another thing that we did as an agency where we created Train the LifeCourse support coordinator learning sessions. Those are led by myself, another family member, and an SC supervisor. We are all parents of children with developmental disabilities, and we use this as an opportunity to help SCs understand the family perspective. And we also explore each principle and practice, and we put the tools into practice. Each session is divided by domains. And one of those learning exercises we do during these are plan audits. We pull several plans for each domain section, and our plans with the agency are already divided kind of by domain. They already have a domain template that they use. We also pull from each life stage. So we redact that personal information and we audit those plans and we talk about as a group what questions we want to ask. And we use the Blue Book to really help assist them in, kind of working through this. So we think about what questions we would like to discuss with the person or their family. And then we also talk about why that is important. Sometimes these audits can reveal how amazing a plan is and what good work someone did. But occasionally it might show that maybe that person needs a little more coaching because it might not have the information you're looking for in that plan. So an example of this might be what places do you like to go in the community? Or, we ask those different things from the Blue Book. So for instance, if someone says they would like to live at the North Pole, that's an amazing answer. And we'd like to explore that. And so one thing that we like to kind of help discuss during this is, kind of digging into the whys. The Trying the LifeCourse are, especially that Blue Book, is a question. Those questions are conversation starters. And it's a bigger picture. It's not necessarily about asking someone to put it down on the vision tool. It's more about exploring their interests, finding out the whys that families do or don't want to do something and supporting them in those visions that they have developed for themselves. We also want to really honor those visions, rally around those people and help them achieve them. We want to celebrate them when they do achieve their goals, but we also want to regroup and continue to encourage them as they make adjustments to their visions along the way.
Thanks, Colette, for that information. And we will have some great questions for you during the panel. So thanks for sharing your personal experience as well as some of the professional things that you've done as a family leader within your organization. So next up is Celia from the Cincinnati Children's Medical Center, who's going to share with us building a vision with key family organizations. Hold on a second, I'm like scrolling through that, sorry.
Okay. So thank you. Yes, she said, I am Celia Schlemmer. I'm the Family Support Coordinator at the University of Cincinnati. You said that sits at Cincinnati Children's Hospital Medical Center. And as part of the Ohio team, I always bring into the space a passion of empowering families through this work and helping them connect and grow into leaders. It's my favorite space to be in. But Ohio overall, in the beginning, took a kind of a bubble up and a trickle down approach. We began this work by working directly with families and getting it into the families fast and hard in the beginning. And then we recognized that in order for it to work, professionals needed to recognize it. So then in year 2 and into year 3, we really pushed it into our agencies and providers, so that would be recognized in school systems when it came in the room. And then after that, we kind of got into this space of kind of this megaphone approach of every place and everywhere. Anytime we could get invited to a room, we jumped in with the opportunity and told them and shared everything that we could. And now in this year, we're really kind of focusing in a little bit more. We're starting to get into grassroots organizations and sharing the tools and setting goals for ourselves, utilizing the tools to really get the message across of how this tool can really empower families themselves and work into this planning and providing a future. So with that, we strategized a little bit more, but for me, it was really all driven by a statement that Shelley had said on one of our support calls when we were talking about the challenge of engagement with the community of practice and getting people involved in that space and sustaining our efforts. And Shelley's response was simple. She said, look for the champions of the work. And that statement really changed my perspective on how I thought of myself as a Charting the Life Course ambassador. And it put me on a journey of noticing. It really is a privilege to support folks and family members like this in a way that they can grow into that role of being a family leader. And what I share from this vision of noticing so far is that you have to remember that this takes time. It can't be rushed. We need to keep a person-centered lens, our person-centered lens in focus, and put our agendas aside and just encourage them to lean in and be sure to highlight to them their contribution and their value in this space. And one way we can do that is to really get out of the way and let them create their place at the table. Know what's important to them. Know your gifts and the things that you can do to allow you to support and enhance their trajectory. And that as we move through this, that those relationships are reciprocal. You can offer to them, they can offer to you, and everybody grows in the long run. I've just been privileged through that growth with the families that I've gotten to work with. As you think about this, you want to be really cautious not to go in with an outcome in mind. I think about a group that I worked with through Children's Hospital called Autism and We, and this is a group of African-American moms of children with autism. And I kept going in and saying, look at this really cool thing I have, Charting the Life Course. I'd love to come talk to you about it. And after 3 or 4 failed attempts, I became very aware of I needed to stop and think about what they needed and how the tools and the framework could help them solve their problems. And so that's when we started talking about my background in working with families at the IEP table. And we started to talk about possibly coming in and doing just a basic advocacy training. And then after the advocacy training, I started to do one-on-one support with the groups to do IEP prep. And that is where our sweet spot was, because then we were able to really see how they could utilize this. And there was a mom that comes to mind. Her name was Krishana. She was a mother of 4, and she just took off with this idea of putting her back in touch with a vision for her children. It helped her reconnect with what she wanted all along. She talks about how it did it in a way that she didn't stay lost or stuck in the day-to-day distractions, but that she was able to kind of refocus. And now she can see very specific points on each of her kids' trajectories as she moves through. And this vision now carries for her beyond the IEP table into conversations with family and into conversations with community. And as a result, Krishana has reinvested in her own trajectory. And she speaks on family panels for the USED. She's a new LEND family trainee. She's offering family support in her community. And she wants to bring the framework and tools into her Cincinnati Public School elementary school where she works. And she's also refocused on a trajectory of wanting to start a not-for-profit to support families with intellectual and developmental disabilities. And she's applied to join an all-Ohio ambassador training that we are going to be holding in January of 2021. And the other one that comes to mind is a group of Hispanic families that I worked with. Natalia, who was an SSA, or a service and support administrator for one of our largest county boards in Cincinnati, supported a group of families who speak Spanish. And it was really interesting to have that champion come forward to me after a training with Charting LifeCourse at the county board and say, I really want to share this with these families. And what a gift it was for her to be a cultural broker as we walked into that space. And she shared her passion for the tools with these families. And then she and I partnered to work with community organizations in the Hispanic community and had a grandiose plan, as you can imagine, and then COVID hit. And we really were able to stop. And as we always tell families, when you've got a trajectory in place, you recognize when you fall off or when you're faced with something that kind of leads you in a different direction. So we were able to kind of bolster up and say, well, what can we do? And in that space, we looked at that one-to-one support that we'd done with Autism and we reformatted our plan and began to do that one-to-one support with her families. And it's been an amazing experience to watch families who often don't feel empowered in those spaces just due to cultural differences and language differences to find a new space to stay solid in what their plan was when they talk within systems like school systems. And she too is now applied for our All Ohio Ambassador Training in hopes to be participating in that in January as well. So what I love about this is that the circumstances can often lead us to focus on goods and services as we've noticed in COVID, but we can drop back and look at those other areas of the star and say, what can we do if in fact we don't necessarily have access to that right now? We noticed with the groups that I worked with in these underserved communities is often they were reluctant to connect outside their community other than for those goods and services, and to have connections like Natalia and like Krishana. It opened doors for us, as a USED, that would not have necessarily been opened otherwise. And we had this common language of charting the LifeCourse, and that we could take away or dispel their fear of discrimination or lack of understanding as we stepped in. So I hope that these examples can show you the possibilities of the Charting the LifeCourse framework and tools and how they play a part in empowering families in their own navigation of systems, but also in creating great leadership.
Celia, that was great. And I love the stories that you share, not only about your personal journey, but the journey of some of the other families, as well as organizationally, watching you guys kind of evolve and figure out how do we best reach out to families in all communities. And so that's great. So Celia will be back on our panel. So we'll see you in a few minutes, Celia. Thank you. Next, I'd like to turn it over to Heather Pike. She comes to us from Oklahoma, representing the Oklahoma Family Network, and she's going to share how they have been utilizing LifeCourse for many years and integrating it into a statewide conference that they host. So turn it over to you, Heather.
Thank you so much, Dr. Reynolds. We were very fortunate, just to give you a little background information, to be introduced to the tools. Very early on, Dr. Reynolds came and presented the tools to a group of family leaders. And I too am a family member of an adult now with intellectual and developmental disabilities. And so selfishly, I was like, oh my gosh, I love these tools, and just thinking about how I could use them for our son and for his experiences and his life planning and really creating that good life for him. And then ultimately working for the Oklahoma Family Network, just being able to share those with families that we work with as well. So just a little background on that. That leads me into a conference that we host every year. It's called our Joining Forces Conference, and it's our Family Professional Partnership Conference. And we have been hosting and planning this conference in partnership with multiple state organizations and other agencies and nonprofit organizations and family leaders. This will be our 14th year for 2021, and we have a planning meeting tomorrow. So this is very exciting to me to always hear about how other people are using the tools, and anytime I get an opportunity to share, I'm always just so thrilled to share about LifeCourse tools with anyone and everyone. So some of the goals of our conference are just bringing together local, state, and national leaders, family leaders, professional leaders, and just really focusing on partnerships, because we know that this work can't be done alone. It can't be done in silos, and we all have to work together to meet the needs of families and communities, as well as the professionals that are working in those areas. We want the participants to gain knowledge and tools, and we always throw in the term, ever since we've started using the LifeCourse tools in our planning, good life is always infused throughout everything that we do and talk about throughout the conference, because that's the main goal, and the objective is just to help people attain that good life as defined by them. And then we also just offer opportunities for connecting, just networking and things like that. So trying to get creative in the days of COVID and how we make that interactive and very meaningful to everyone that will attend in 2021. But I have no doubt we'll figure it out. We have a smart group of people. So if you want to move this slide on, this is just a quote that is very meaningful to us in our planning. We all know that if you want to go fast, you can go alone, but if you want to go far, you have to go together. And that really is what our partnership conference is all about. It's just coming together and addressing issues, challenges, celebrating successes, and figuring out how to move that forward and make our state a place where families can attain a good life. So just a little history. Shelly came to Oklahoma, and Shelly, I don't remember what year it was. It was probably maybe 2012 or something, maybe 13, and shared the LifeCourse tools with a group of family leaders as well as some state leaders. And then in 2014, we had Dr. Reynolds come back, and she was our keynote at the conference, and really just shared kind of an overview of the tools and the development of the tools and how to implement those in conversations and planning. And then we had her come back in 2015 to the conference as the keynote speaker again, and really took a deep dive into applying the tools and putting into action the framework. And so since that time, that has been a part of our conversation in planning the conference. We've had a lot of the same planning committee members since 2014 and being able to carry that torch forward. But really in 2017, Crystal Bell came to Oklahoma, and she was presenting on the LifeCourse tools again to a lot of our agency leaders, as well as state employees and Developmental Disabilities Council and different agencies and organizations. And we invited her to our planning committee meeting. And at that meeting, it was really an aha about how I myself was almost limiting the power of the tools. We had incorporated the tools with Dr. Reynolds in, getting the tools to families and professionals, but really the tools, we started using those as planning the conference, especially that trajectory and the star chart. In using that trajectory, Crystal really helped us figure out how to plug in, what do we want this conference to be? What do we not want this conference to be? And really helped us step back and kind of helped guide those discussions and that planning. And we've done that ever since. Crystal's been a part of that conversation. So fast forward to now, really it's just become a natural part of the conversation, not only at the planning conference, but just in my mind. I mean, the tools on paper are fabulous tools, but they really become, and you can just infuse them into conversations with families, conversations with planning, conversations with looking at an organization or a conference, and just really using those tools in a way that are meaningful to anyone and everyone. Because although they were developed for people with intellectual and developmental disabilities in mind and their families, these tools are limitless as to what you can do with them. And I was just on a call this morning with the Institute for Child Advocacy. They had their fall forum, and one of the presentations was on ACEs and PACEs and hope and, you know, all of those things that are big conversations in states right now. And I just kept thinking to myself, the LifeCourse tools would fit beautifully with these conversations as they're working with families, working through, you know, goal planning and that vision for a good life, and looking at the STAR chart and not just looking at eligibility specific, but looking at the community piece, the relationship piece, all of those things that fall within the STAR, and really help guide those conversations as you're working with families. But we love using the tools for our planning conference now, and we're so thankful that we were connected with Dr. Reynolds and then Crystal later on to really help us keep that vision and that conversation going as we planned our conference. So.
Great, Heather. Thanks for sharing that. And it's really fun to kind of see that timeline as well, because Oklahoma was one of the original community of practices. And I want to even say, before the community of practice was even a thing, being a UCED, a University Center on Excellence in Developmental Disabilities, the Oklahoma Family Network was connected to some work that we were doing nationally with the Oklahoma UCED. And so it's fun to kind of look back on that timeline and see that evolution. And, you know, we're constantly learning from you guys on all the different target audiences you're working with and the different types of families and the different way that you apply it. So I appreciate you sharing that with everybody. So Heather will be back on our panel as well. So be thinking about any questions that you want to ask. You can put them in the chat or the question and answer. With that, I'm going to pass it over to Beth Kessler, who is with the Oregon Developmental Disabilities Council.
Thank you. So hi, everybody. I am with the DD Council here in Oregon, and we've been engaged with the community of practice for a number of years now. And I can say that we've tried lots of ways of embedding the framework in our work. We have a close partnership with our DD program and are currently continuing efforts to better embed the principles of the framework and also related tools in our planning processes. And we embedded it in our strategic plan a couple of years ago with the department. So a lot has happened. It is slow work, but a lot has happened at the systems change level. And at the local level, what's great about the council's engagement in the community of practice and what I love about the framework is its adaptability. So the idea that the council is able to engage at the systems level while also engaging at the local level and at the personal level with individuals and families. One of the ways that we've done that from the beginning is through family networks. And we've heard some fantastic examples today of family networks around the country. And I'll say the term family network, I think similar to lots of other terms in our field and in our community, mean lots of things. And in Oregon, we noticed a number of years ago, there was a trend in what I'll call supporting families, which was focused primarily on access to information. Right. And what the Charting the LifeCourse framework, one of the things that it's taught us, and one of the first things I grabbed onto was the concept of 3 buckets, and that information and learning is really just one need that people have. So actually, if you can back up one slide, sorry. Thank you. So what we tried to do is kind of acknowledge the more complex and diverse needs that existed within our community and think about what we wanted to achieve out of supporting families. And in some ways, this sounds callous, but we weren't trying to support families simply for the sake of supporting families, but because when families are supported, amazing dynamic things happen for them, for their family member who has disability, and for the community where they live. And so what we really wanted to focus on was the why of investing in family networks. It was the trajectory. We wanted empowered families. We also wanted those empowered families to intersect with empowered communities, so that when families were encouraged and supported to want something different for themselves and their loved ones, they would stop hitting walls of communities that weren't prepared to address those support needs and share that vision for the future. What we didn't want was continued segregation and isolation for families, because we know that isolated families who experience segregation raise adults with disability who continue to be isolated and experience segregation. And if we want welcoming communities that support all community members, segregation is not welcoming. And so we were trying to really shift the trajectory and use family networks as the vehicle to do that. So in the next slide, you see the 3 buckets, right? So how we were going to go about doing that from the council's perspective. We know, and the framework reinforces, that humans have different kinds of needs, right? And what we believe at the council is so do organizations. We believe organizations, which are made up of people, have the same needs for relationship and connection, information and skill building, and stuff. And so what we developed at the council was a vehicle to provide that structure for family networks themselves, so that family networks could then pursue that change in trajectory for families and for local communities. So we contracted with a number of regional community-based, family-led family support organizations. And we basically said, we're going to, in partnership with the DD program, fund that you all, family networks, come together, establish relationships, share information, help each other develop skills, and figure out how to connect to goods, equipment, stuff. Sometimes we talk about the family networks in Oregon as community connectors, because they are not funded in a way that allows them to meet every need for families. They are funded in a way to be a connecting point and establish the kind of social capital in local communities that means families are more likely to have their needs met in their local communities. And if we think about the integrated support star, to be able to meet needs in diverse, colorful ways, so they're not funneled and directed to green lives, right? So we bring these organizations together fairly regularly, and they share with each other what they're trying. They share with each other what's working and what's not. They share resources. They share each other's social capital, right? If one organization is struggling or has a family struggling, they reach out to the network of other family networks and say, who has figured out how to address this? Is there a person we can go to, right? So that connecting point has helped each organization then have the infrastructure that they need to sustain their work, right? It is slow work to change communities and to change the trajectories that families will experience when they live in those communities. And that slow work, you need your peers, right? And family leaders need their peers as much as families in local communities need their peers. So as a result of that work, sorry, next slide, thank you. What we've seen is that families are strengthened, community partnerships are strengthened, and the result is communities that are increasing their capacity to support families. And we're seeing increased social integration, right? There was a Brigham and Young study that talked about long life, and more so than clean water or tobacco use, the two indicators of long life were social integration and meaningful relationships. And so we believe that we are directly impacting the social determinants of health for families, and therefore the individuals with disability growing up in those families, by decreasing the social isolation, the family experiences when the child is a child. And I just want to say that this is work that is funded by our DD program. It's been funded by our DD program and legislatively approved every 2 years for 8.5 years now. And every time our state sets a budget, we're able to leverage the strength and support of the DD Council to help families advocate for continued funding. Now we fast forward, right? 8.5 years. We had unprecedented wildfires in Oregon recently. And beyond the devastation for communities and families that brought, it also brought significant budget constraints in our state on top of a pandemic, right? So I want to just say, in terms of the power of family networks and the impact they can have in local communities and for families, we lost the state funding from the DD agency for this work this year. And this work funded by the DD program will end December 31st. But the amazing thing is, while we're gearing up our advocacy to get that funding back, and I am optimistic we will get that funding back, but the amazing power of engaging and using these concepts and living these values at a local community level is immediately, when that state funding was lost, we had local organizations, local partners, case management organizations, providers, community foundations reach out to these family networks and provide them gap funding. None of these family networks are going away, even though we have this period of time where we've lost the DD agency funding. And I believe that's a true testament to the sustainability and the value of this work in local communities wherever this work is happening.
Beth, that was great. And Beth will be on the panel as well for us to ask her more questions or to get some more feedback. So we have 2 more panelists, and then we are going to move over to our full panel. So right now I'm going to pass it over to Erin, who has been was a part of the community practice from the get-go, one of our original states. So I love watching her personal evolution as a disabilities leader, as well as hearing how she really transformed things for families in DC. So Erin.
Thanks, Shelley. I am Erin Levitin. I'm a director with Alvarez and Marshall Public Sector Services, and my work is in supporting state developmental disability systems. As Shelley said, I've been super lucky in that been involved in the supporting families community of practice from the very beginning. DC was one of the first 6 states to join the community of practice. And, pretty quickly, once we joined, we realized that as a state agency and as state leaders, we had regular monthly meetings with provider agencies. We coordinated with our sister agencies. We attended our Project Action self-advocacy meetings each month. But really, we had no regular venue for families to talk with leadership unless they had a complaint that rose to the top. And so having a community of practice changed that. And what we learned was that it gave us ongoing access to real content experts. So the families that we were meeting with, we realized so quickly were the people who knew the people we supported the best, who wanted the best for them, and who really understood how our system could support or get in the way of people living their good lives. And they were a group of people who are willing to help us begin to envision something better for their children. Next slide. So, careers in social services, right? They're a funny thing. You typically start on the ground. So for me, I was a paralegal, a paraprofessional in special education working with transition age youth in a segregated school. And, at some point, you're traditionally successful, you get promoted, and you find your work takes you away from the people you got into the field to support in the first place. And so you're writing policies and waivers, and you're calculating budgets and supervising people and doing planning. And you realize that you have to start scheduling time to visit the people with intellectual and developmental disabilities and their families that this work is all about. And so the Charting the LifeCourse principles gives state leaders a way to change that dynamic and get back to the foundations of why we do this work. At its core, the transformational policy and systems change principle says that people and families are really involved in a deep way in developing the systems, policies, and practices that affect them. And so, next slide. If we really listen to people and their families to develop our system priorities, and then we work with them to craft those policies and practices, and then we go back and we say, what's working about this and what isn't working about it, something really magical starts to happen. We end up not just raising our expectations for our service delivery system, but we see those parents starting to have higher expectations for their children. We see self-advocates wanting more, and we see ourselves becoming different and better leaders. Next slide. About 1 year into the DC community of practice, we asked family members to tell us what was working and not working about our system. And we ended up collecting poster sheet after poster sheet after poster sheet of things that they said were not working. And honestly, it was frankly devastating. At that time, we knew our system was not where it needed to be, but we were all working as hard as we could to make things better. Go to the next slide. But at that moment, right, we realized what had happened was we were about a year in, maybe more. We had finally hit a point of trust where family members and self-advocates at our community of practice meeting started to realize that we were really listening, and we were listening with intention of acting, and they began to really talk to us about what needed to change. Next slide. So we took that list and we trended it, and we ended up with the priorities for systems change that the DC system has spent, frankly, years working to improve, because systems change is a little bit slow. And so what families were asking for were things like deep and ongoing investment in person and family-centered thinking, better employment outcomes for people with disabilities, peer supports for families, and real opportunities for self-determination. And here's where we are today. DC is now a leader in person-centered thinking. While there's still far to go, they have significantly improved employment outcomes for people with disabilities. The DD Council supports a parent-to-parent to offer peer supports. Families and self-advocates rose up to support successful legislation that ended the practice of civil commitment of people with developmental disabilities and formally recognized supported decision-making. And you can see them at the bill signing with our mayor right there. And DC right now is working towards a self-directed waiver. But the thing is, this is not happening just in DC. We see changes like this happening all over the country. Changes to systems that lead to changes in people's lives. When COVID struck, you could see the foundational principles of the community of practice in action all over our nation. So Connecticut, who like DC and like Oklahoma was one of those original 6 community of practice states, very quickly launched an individual and family survey to hear directly from people in services and their families about their ideas for reopening, and are using that in shaping their plans. Oregon, who we just heard from, right? Another initial community practice state, shared LifeCourse tools like this LifeCourse trajectory with families to help people plan for how they could have a good life during the pandemic. My home state of Maryland began talking with families about their experience with COVID-19 and their vision for what the system should look like moving forward. And they're already making changes through waiver amendments to implement this. You know, like now more than ever during the pandemic, we need to come together as bureaucrats, as providers, as advocates, as family members, as self-advocates, and partner to create the systems of the future. And for me, the LifeCourse framework provides the trajectory for that vision. Thank you.
Erin, that was excellent and a great overview of just seeing how the culture within the DC state system has changed and evolved, and really how the voice of self-advocates and families really drove that change. So thanks for your leadership in DC and around the country in this work. Oops, excuse me. So the next person I'm going to give a few minutes to is Yoshi, who's going to share with us some of the work that she's doing and partnering with the Nexus to really make sure that we're evolving to really accomplish our goal of reaching the all.
Hello, everyone. My name is Yoshi Cardell, and I work with Human Services Research Institute. I've had the opportunity to be connected with Charting the Life course as a member of the national project team that was leading the community of practice. And so I'm so honored and thankful to continue to have opportunities to be involved. So one of the projects that I've been working on has been to ensure that the Ambassador Series is accessible for all who want to go through it. So the Ambassador Series is an opportunity for people to take a deeper dive into the principles of Charting the Life course. It takes a number of weeks to complete, and it involves receiving some coaching from members of the team there at Charting the Life course Nexus, as well as in between the coaching sessions, the participants are required to do some additional assignments and some work on their own in between. At the end, people receive a certificate as a Charting the Life course ambassador. So we know that this is such a fantastic opportunity for people to really be able to apply the principles of Charting the Life course. So we know that we want this to be as accessible as possible. So I've just been working with the team there. We have identified some self-advocates who have been willing to work with us and to help us make sure that every aspect of the Ambassador Series, from the time that we are announcing information about this opportunity all the way through completing homework assignments and everything else, that all of those stages are accessible. So we have connected with the Oregon Council on Developmental Disabilities and Beth and some of the self-advocates there who have been willing to go on this journey with us to help us, again, increase the accessibility of this opportunity. Unfortunately, because of the, kind of a little bump in the road in terms of COVID and what that presented to us, but we do hope to really continue this work. And with the interest of time, I did have some slides here, but I know we're very excited to get to the panel. So I think we just wanted to let you all know that this work is continuing, and we hope to provide some updates in the future. So with that, I will turn it back to Shelley. Thank you.
Thanks, Yoshi, and thanks for sharing that work that you're doing with us, because we always say we throw the dart at stuff. People ask for stuff and we try to respond as an organization, and we know that our first try might not be as universally designed as it can be, and so we're constantly always pushing ourselves to improve, whether it's accessibility with technology, with language, with visibility, and so your feedback as people that are a part of the LifeCourse network are very important to us. And so we just wanted you to know that we're constantly working on that and having those things. So if I could have all of the panel members pop their screens, turn their cameras on, I'm going to remove the PowerPoint for a minute and move us into our panel, so you can unmute your phones as well. And I just wanted to take this opportunity to give people a chance to ask any questions. And also, I'm going to start out by asking you some questions, but if other people have other ones too, we can definitely answer those. I do see one that's up that we'll answer in just a second, but I wanted to give the panelists an opportunity, and someone can raise their hand, whoever wants to go first, if you have to think about this. But, you know, people always say, like, you guys have told great stories. Some of you have been involved for 5 or 6 years, so you've talked about your personal and organizational evolutions. You have some people that are watching this right now that maybe just started, they're just introduced to it. And, you know, some people say to me, you know, it's so easy, I love it. And then they actually sit down and they're like, wow, that's a lot more complicated than I thought. Or, so like if you had to give 1 or 2 words of wisdom or advice or lessons learned that you personally have gone through, or maybe that now that you are teaching others about it, that you would share. So, so I don't know who wants to go first on that one, but I can call on you. You want to go, Celia? You can start us off, and then I'll move to you, Beth.
I'll keep it really short and sweet. Kelly Flotter, a teacher that I work with, always starts her presentations with families and says, this is real, and teachers who are going to work with families, and says, this is really personal work. It's intimate work. And I think recognizing that going in prevents that need to kind of move through our agenda. It gives us that space of just sitting and letting them kind of be with it for a little while and revisit it, and just know that it takes time. You can't emphasize that enough, and that it's super personal.
That's great. It's that sort of self-discovery and self-reflection that the tools can bring out. That's very great feedback. Beth?
Yeah, I would just offer that, I mean, we struggled in Oregon, and it took me a long time, I think, to figure out why and how to address that. But it came down to, when you introduce a thing, people either embrace the thing or they reject the thing. And when we stopped trying to introduce charting the life course as a thing, people are open to ideas and different ways of having conversations. And I used to hear Shelley and Jane and everyone at UMKC talk about the difference between the framework and the tools. And I think when we introduce the tools, people think we're introducing a thing, even if we try to say we're not. But when we break down a concept and we talk about the idea of trajectory having, you know, 3 core elements: what you want, what you don't want, and where you've been, people don't either embrace or reject. They just tend to kind of, with your words, Celia, sit with that and find what resonates. And I think people find their footing differently here when we break down an idea and we talk about ways to embed or explore that idea, rather than trying to introduce the thing that is the framework in its entirety.
And I always tell people that a lot of the people over the years that I've partnered with and mentored and coached and learned from, quite frankly, I always say, I can tell when you've evolved when you stop hosting a Charting the Life course workshop and you host a employment workshop that utilizes Charting the Life course, or you host something, like you said, a concept or an outcome you're trying to achieve, and you're using the tools as the method to get there. And I see that sort of evolution of, once people have a basic foundational understanding of, now moving to, why is it that I'm using the tools and what am I introducing? So Heather, what would you like to add to the lessons learned?
Did you know I wanted to add something? I think it's one of those things too, just giving really good examples of how you've used them personally or other families have used them. I think that's always helpful. And then just small bites of it. Just introducing it, small bites. And then also, kind of like what Beth said, it's making it a part of the conversation. It's, not throwing a thing at people. It's a way of thinking, truly. and just implementing that is throughout the day, throughout conversations and throughout your planning and how you think about things.
Great. Colette?
I want to echo everything that I agree with everything all the other panelists said, but then I'd also like to add as a parent, just in relation to my journey and some of the things that I've noticed about other family members or people when they do it, is sometimes it can be a little emotional as well, because you have those moments where you realize that you were making decisions, you were doing the best that you could, and you were making the decisions that you felt were right at the time, but you have to sometimes acknowledge that they weren't really pushing you towards that vision that you wanted, and it was the opposite direction. And so sometimes that can be a little hard, and sometimes people need a little space to kind of regroup after they realize that some of the decisions they made didn't really match up to what they were wanting out of their life.
That's really helpful that you share. And I have seen that. I've seen guilt. It's sort of like people wrestling with guilt from things they just didn't know. They did their best. Or and it can also bring up, looking back on your past, could even bring up some life experiences and trauma that people have. And so I do think that it is important for people to realize that if a professional is using this and they just see it as a tool and a worksheet, and the family is seeing it as this, self-discovery, there's a disconnect on one, how it's being facilitated, but two, what could come of that. And so I think that you bring out some really great points. Karen, what would you add?
I want to echo everything that everybody said. I really appreciated what Celia spoke to when she presented about how she had this, she had this tool and she wanted everybody to use it and they wouldn't use it. And then she found the end with using some of the tools as for an IEP meeting and such. And, it's really when you're a parent and you're overwhelmed and you get something else thrown at you, you're like, I don't need anything else thrown at me. So when you're throwing a thing at them, you're going to get some resistance. But if you can just start sharing some of those concepts and showing how you use those tools and how it can benefit you, then it doesn't feel like a thing. It doesn't feel like, it's something more that I have to do. And it really allows us to meet parents where they're at. Everybody's needs look different, support needs look different. So it really allows us to really meet that individual family's needs. And that's what's so wonderful.
That's great, Karen. Thank you. Erin and Yoshi, is there anything one of you would like to add to this? Erin?
Yeah, I'll start. I mean, I think, I agree with everything that was said here. I think the tools look deceptively simple, right? They're an arrow, they're a star. And once you get into them, you realize they really are dynamic and reflective. And when done with intention, they have a lot of power. And the thing that I have really thought a lot about in my journey over the last 8 years in LifeCourse is, what does that mean for a state system? And how do you use these tools in a way that really help us do discovery and learn about people and support people to have a vision and families to have a vision, but not use it against them and not make it part of a checkbox or a tool. I don't have the answer to that yet. I would love to find somebody who does, but I do think that's part of the real challenge moving forward.
Yoshi, anything you would add to that?
I would just echo what everyone has said. We at HSRI, we are I think really in the habit now of using the tools, using the language of charting the life course, and it just really helps us have those conversations about really, I think, anchoring ourselves in the direction that's guided by vision and what people really want in their lives. And so I would just echo, and it's been nice to hear everyone's perspective. Thank you.
And I'll just kind of add on as we kind of start closing this panel down is that, they were designed to reframe, is what I always tell people. So it's not for them to provide, people say, well, when do I get started? Or I got started too late. Well, the first time you're introduced to them is the right time to start, whether you're 85 or you're working with a newborn. And, and it really doesn't matter the situation, right? Yes, you can utilize them with people with disabilities, but you can also use them to think about retirement or a trip you want to go on or how you're going to deal with isolation with the pandemic. So to me, it's they're, when people start lumping them into like Erin says, exciting. It's moving into policy discussions, but when they're the design more for you to self-reflect and to learn. And I think the other thing that really resonates with me and why I am so honored to be a part of this panel with you guys is that I think if you team up the power of the tools with someone that has lived experience, like a family leader or a peer with a disability, it amplifies their use because not only are you utilizing the tools to create those conversations, but you're leveraging that experience of walking the walk and going through that together. So how are we utilizing family leaders and peer support leaders? And having leaders like Erin and Beth who recognize the power of that role in our field is so very, very vital, I think. And that really came across today in this conversation. And I think the more that we can have the voices of all people, all different cultures and languages and life experiences, to me, the tools were designed and open-ended so that the true person-centeredness came through in that regard. So um, I really appreciate this conversation. I'm so glad that we were able to use this as our showcase closing because I really sees the impact on families and the hard work that your family organizations are doing and really how person within the context of the family can be realized. So with that, I'm going to have some of you turn your cameras off. I'm going to have you, Heather, leave your camera on, and I'm going to actually ask your son to go answer the front door. And you're muted, so.
Ask my son to answer the front door. Is that what you said?
Uh-huh.
Layton, what? Will you go answer the front door? Do you know something I don't know?
Maybe. We'll see. I have another screen to pull up on just a second. So we always give an innovation award during our virtual showcase.
Yes, you guys. Well, my husband said, Joni's outside. And I was like, well, I hope everything's okay.
And so Heather, as you can tell from her panel presentation, has been a part of Charting the Life course really since its inception and has really driven the work in Oklahoma and pushes us nationally. And so during each one of our showcases, we like to highlight the work that's happening from around the nation in different ways. And so Heather's really, really represented how you can integrate this within a family network. So we wanted to recognize that this year as your 2020 award.
I'm gonna cry. I wish we were doing this in person, but this is so precious to me. Thank you. I really appreciate it.
Oh, you are welcome. We appreciate the work that we're doing. And Joni, we appreciate you. I don't know if you ran out of there really fast.
She snuck out the door with her mask on.
I know. She was like, we were like, how are we going to do this? But Heather, congratulations.
Thank you. That means so much to me. You have no idea.
Well, it's very well deserved. And so you'll get an email from Jane probably saying, make sure that you get a picture tonight with you and the award and you and your family if you want, and send it our way so you can be added to our innovation wall on our website. Yay. So thank you. And I have a couple more slides to kind of wrap this whole thing up. But so I thought I would, since this is our closing, you'll see the poll is all up if you're jumping off, if you take our poll really quick. But I wanted to kind of just summarize and say, as we look into 2021, first of all, how can you continue learning about Charting the Life course? If you haven't seen any of the other monthly live sessions, I strongly encourage you to do that. If you don't have time to sit through a whole one, we have smaller TED TED Talk like videos that also accompany them. So each month now is on its own page. So you can go in and you can look at employment. You can see the smaller breakout sessions. You share those with staff, share them with families. Continue your journey of learning yourself. The other thing is you've heard a number of people talk about the ambassador series. And, originally we only did this with organizations that request that, and we will continue to request or continue to provide that support to organizations that want that. But we started hosting what we call an open series. That just means anybody can sign up, and we're going to host these series kind of every quarter they begin to open. If you go to our website right now and go under the word I want to say it's ambassadors. I can't remember what it is. Then you can see that you can get signed up for ones that are going to start in January. And as those fill up, we'll open others up, and we will continue to do that quarterly. We are looking towards evolving and having some specific to education, another one specific to employment. And so as we have another one specific to family leadership and family networks. And so, reach out to us. We're here to try to figure out how to meet your needs for your learning. The other thing is if you are an ambassador, or once you go through the ambassador series, you're a part of the network. You will continue to receive updates and information through our online community. And during 2021, we're hoping to host some live sort of get-togethers and virtual conversations so that you can learn from the other ambassadors that are out implementing it at different levels. Organizationally, you can contact us anytime. You can host us as presenters. We will create a customized training and technical assistance package for you. So there's many ways to engage with us. You can become one of our partners in development, which means maybe you have a new idea, or you need a new tool that you want to use, or there's a new topic or discipline you want to take this to. Or maybe there's research. We want to continue to move it from an informed practice to an evidence-based practice. So are there things that you're evaluating or researching? Can we get that on our website? Can we share that? Can we continue to build larger research projects? We also have a lot of organizations contacting us about integrating it inside their technology. So if that's something that your organization's interested in, we have different levels of licensing agreements that enable that to happen. So there's lots of ways that you can stay connected. Our website continues to improve. Jane St. John works closely with our web designer to really ensure that the tools are on there, and we continue to try to make it as user-friendly as possible. So what does this mean for 2021? So with the closing of the showcase, usually you can talk about a new date for next year. We are not planning on having an in-person event in Kansas City in the first part of next year. We don't know what we're going to do for next year. We're sort of leading it open, but we will do something. We're sort of, just as everybody else is around the world, sitting and waiting. What's the next 6 months to the next year going to look like? We know it's important to keep the conversation going. We know it's important to get the information out to you. So we might do this virtually. At the end of next year, if people are starting to have small gatherings, we might do some co-hosted events in your community or in your state or in your region. I imagine we're going to be completely zoomed out, hopefully by 2020, 2021. So maybe we'll be thinking about other different virtual ways to keep you engaged and to keep sharing the information. So do know that something will happen in 2021, but we are not really sure. With that, though, I'd like to really thank our sponsors again, who continue to not only sponsor the showcase, but they continue to partner with us. They are committed to the concept of all and how we're reaching all, not only through their products and their work, but also ensuring that the Nexus is supported to be able to support you guys. And for that, I really, really appreciate our sponsors, Aetna, Therap, Quillo, Station MD. You heard from Sonderbloom today talking about the new online platform, hopefully will launch in 2021. And I am IPMG as well as a partner at our Blue Level status. So thank our partners. please take the closing poll if you don't mind before you leave. And we really appreciate you spending your afternoon with us. And if you have any questions for us, let us know. And we're here to support you on your journey using LifeCourse, but really on your journey in life. So thank you for attending and be in touch.